Worldwide Achievers presents Healthcare Excellence Awards. Dear partners, Care World, Medical Times.
Ladies and gentlemen, please join us in extending a very hearty welcome to the Honorable Chief Guest of the ceremony, welcoming Shripad Yesso Naik, the Honorable Minister of State for Health and Family Welfare, and he's also the Honorable Minister of Independent Charge with the Ministry of Ayush. Thank you very much, sir, for gracing the occasion and joining us. Honorable Minister, sir, and other distinguished dignitaries, our special invitees, our esteemed guests, all the healthcare professionals and experts, and all the other stakeholders across the health value chain, ladies and gentlemen. Indeed, a great pleasure to have you all here and to be welcoming all of you on behalf of Worldwide Achievers to this prestigious award ceremony, the Healthcare Excellence Awards for the year 2015. And these awards, ladies and gentlemen, are towards rewarding, recognizing and appreciating your contribution, your work, your achievements, your accomplishments, which you have been extending towards building our Arogya Bharat and a healthy India by extending your expertise, your experiences, your technologies, your state-of-the-art infrastructure, your diagnostic services and other services, and more importantly, your will and your commitment to be working for the nation, working for your patients. And this evening is towards saluting all that effort of yours. And though most of the people who are going to be awarded today, they are from the private sector, but they also look forward to the support of the government in terms of the policies, in terms of also a conducive and an enabling environment for them to work. And towards that, ladies and gentlemen, we are extremely gratified by the presence of the Honorable Minister present with us, a very key policy maker and decision maker who has been able to introduce a lot of reforms, a lot of initiatives which the Ministry of Health and Family Welfare has taken very recently. And as he's also the Minister for Ayush, that is where we are promoting our traditional wisdom, traditional knowledge of Ayush, of Unani, of Ayurveda. And as you all know, the Honorable Prime Minister, we had celebrated the Yoga Day, and that is where the vision of the Government of India was extended and brought to the notice of the world. That is where we are wanting to extend this traditional wisdom. So we thank the Honorable Minister for being present with us, someone who is definitely in a capacity, capability and a position to create this conducive and enabling environment to bring about the ease of doing business for all of us and towards promoting the growth and the evolvement of the healthcare sector. So thank you so very much, sir, for being present with us. And may I request you, sir, to please grace the dais. Please join us, ladies and gentlemen, as I now invite the Honorable Minister to please join us here on the dais. We are also very delighted to have the presence of our guest of honor, Padamshree Dr. Jitendra Kumar Singh, the National Vice President, Indian Medical Association. Thank you, sir, for being with us. It's again extreme honor that we have your presence with us today. Ladies and gentlemen, I'll just take a minute to introduce Dr. J.K. Singh. He is the Director presently of SS Hospital and Research Institute, Patna. He's also the Chairman cum Managing Director of J.K. Institute of Medical Sciences, and this is an upcoming comprehensive cancer institute at Hazipur. He was the Director of the Mahavir Cancer Sansthan for the last 15 years, and he is presently also the National Vice President of the Indian Medical Association, Delhi headquarters. In 2012, the Government of India conferred on him the Padamshree Award for his outstanding contribution in the field of cancer. Thank you, sir, for joining. And I would also now like to invite here Shri Naveen Sinha, the co-convener, Sahyog Cell BJP, to please join us. I presume he's going to be joining us later. And now, ladies and gentlemen, we extend greetings to our distinguished guests. May I request and invite Mr. Barunwal to please present the bouquet on behalf of everyone present here, extending greetings to the Honorable Minister. Thank you once again, sir. And may I request Mr. Chaudhary, inviting Mr. Pradeep Chaudhary to kindly present the bouquet, welcoming Padamshree Dr. J.K. Singh. May I request Mr. Barunwal also to please join us, and let's start the auspicious beginning of this award ceremony by lighting the ceremonial lamp. May I request the Honourable Minister to please initiate the lighting of the ceremonial lamp, and also requesting Dr. J.K. Singh to please join in. Thank you to the Honourable Minister. Ladies and gentlemen, before we move to the award ceremony, and before that, as I invite the Honourable Minister, I'll just take a few minutes to set the context of these very awards. As we mentioned, that yes, the healthcare sector in the country is definitely growing. It is in fact growing at a pace, and it is expected to become close to $280 billion industry by 2020. There have been various reasons which have contributed to this growth. There has been rising income levels, there have been growing elderly populations, and then in addition to it, there have been changing demographics, there have been disease profiles which have today shifted from the chronic to the lifestyle diseases. And as we had a seminar, sir, just now, where we had our experts talking from nephrology, from cardiology, and also from oncology, and we saw that the lifestyle diseases are actually on the rise, but then people are becoming more and more health conscious, and that is where they are spending also on the healthcare delivery. Significant progress has been made by the government reforms, by the policies, by the new programs which have been initiated by the government. Even the private sector has today joined hands in promoting and further improving the quality and the access to the healthcare services. But in spite of these initiatives and in spite of this growth which we see, our country, ladies and gentlemen, nearly 1 million Indians die every year due to inadequate healthcare facilities. And then there are some 700 million people who have no access to specialist care. India, as we heard, is the diabetes capital of the world. There is an increase in the non-communicable diseases. There are some 10 million people who die every year of the chronic hunger and the hunger-related diseases. And in spite of this economic growth which we are seeing, India has one bed for every 1,050 people. And we have 0.7 doctors and 1.5 nurses per 1,000 people. As per WHO, it should be 2.5 doctors and 2.5 nurses for at least 1,000 people. Major concentration of health care, of the infrastructure, of the services which we see is more in the metropolitan cities or the urban areas, but if we go to the semi-urban areas or the rural areas, we see that they are still relying or they are still receiving the services from the unqualified practitioners. We also see a huge shortage of medicines, of diagnostic centers, and in order to meet the manpower shortages and to reach the worldwide standards, India would require an investment of up to $20 billion over the next 5 years. And towards that, it's going to be government funding. It has to be from the public-private partnerships, more of private initiative, which is going to be bridging the gap. Some of the positives which we see the government of India has introduced, we have been able to eradicate polio, and we have been declared a polio-free country by WHO. And to achieve similar kind of successes, now the Government of India has also initiated many other programs towards HIV, towards hepatitis, where we are wanting to achieve the same kind of success. There is also towards the newborn babies. As we know, the mortality rate in the country is very high. So these are some of the initiatives, and where the Government of India is also tying up with the media, where the media is playing a very important role in taking these messages to the people at the last mile. There have been various development partners. We have UNICEF, we have UNAID. All these are joining hands, WHO joining hands with the Government of India and reaching to the people who definitely require this care. We also see the initiatives which have been taken by the Ministry of Health towards telemedicine. That is where we see also the private sector which has joined hands with the Government of India. Again, telemedicine in again creating awareness. We have where the places where the infrastructure is not available, where the doctors can't go, there telemedicine is being extended. And at the same time, certain medicines which are not available, we have many private sector which has joined hand with the Government of India towards extending these generic medicines to the people. So these are some of the positives we definitely see. We have a very committed government under the leadership of Prime Minister Modi, which has a focus on reducing malnutrition, in improving the use of essential medicines, in expanding immunization. There is a massive immunization program which is by the government, modernizing our public hospitals, instituting a better tobacco control program. We discussed about that one of the major causes of cancer is tobacco. So we have the Government of India's program towards the tobacco control program, and the Government of India is wanting actually a holistic care system that is universally accessible and affordable to the people. But with all these positives also, as we did talk about the challenges and the constraints, the industry definitely looks forward to the support of the government, and towards that now I would like to request the Honourable Minister to kindly share his views and the vision of his government and ministry.
Dr. Jitendra Kumar Singh ji, Sri Naveen Sinha ji, ladies and gentlemen, worldwide achievers, distinguished guests, I thank the organizer for inviting me as a chief guest in the 5th Healthcare Summit and Awards. I'm happy to be participating in this event that not only honors those who have taken the initiative and lead in provision of the healthcare services, but also provides a platform to discuss the key issue in the health involving all key stakeholders. In the last 2 decades, India has made a significant progress in improving the health of population. I am happy to say that the country is broadly on track to achieve the 3 MDGs related to the health sector. In 1990, India had a 40% more child mortality rate compared to the global average, which today is almost same as global average, and we are close to the reaching the target of 2/3 reduction in the under 5 mortality rate from the level of 1990. Our MMR was also higher by over 40% in 1990 as compared to the world average today. We are below the global average and should succeed in achieving the target of 3/4 reduction in MMR from the 1990s level. Prevalence and mortality from HIV, AIDS, TB and malaria have shown as a decline trend from the level in 2000. Further, India achieved a polio eradication, which was mentioned by Madam Compariser, that even when we had half the global burden till as late 2009. This year we have been successfully in eliminating the maternal and neonatal tetanus. The single biggest factor behind this success has been the robust partnership with the various stakeholders. We need even stronger partnership to achieve 12 target under the Sustainable Development Goal 3 to ensure healthy lives and promote well-being for all by 2030. However, despite this significant achievement, challenges remain. India is one of the fastest growing economies in the world, but it is also home to approximately 35% of the world's poorest people. The country's healthcare scenario also reflects this dichotomy. While India is recognized as a destination for medical tourism with world-class healthcare with the private sector, on the other hand, there is a vast segment of rural and vulnerable population that lack access to even the basic healthcare. The critical importance of the health and well-being of the population and its impact on economic progress of the country is an established fact, and the linkage of poverty, health and economic outcomes is undeniable. This also clearly reflects the adoption of the SDGs. One of the pressing challenges is the sheer complexity of the health sector in India, with numerous players and multiple sectors that impact on the health outcomes. Public health being a state subject, there are wide variation in the state in governance, regulation and development, which finds a translate in varying health scenario across the state. Health outcomes are dependent on the policies, programs and performance in the other sector, such as nutrition, drinking water and sanitation, road safety, girl education, age at marriage of girl, occupational safety, air pollution, tobacco use, etc. With nearly 58% of all healthcare expenditure being made through the out-of-pocket expenditure and nearly 40 million people getting impoverished on account of the healthcare expenditure, providing the affordable healthcare of quality to all is one of the most important concerns before us. Further, there are equity considerations given the wide disparities in the health outcomes across the southern and western states on one hand, and northern, center and eastern states on the other. Wide variation in rural and urban scenario, and also among the different social and economic categories, besides wide intrastate variation in provisioning of healthcare. For the private sector, with almost 60% of the hospitals beds is largely concentrated in urban areas, metros, Tier 1 cities and larger towns, serving only about 20% of Indians' population. Rural and peri-urban areas are served largely by the public facilities, providing only about 37% of the hospital beds, but catering to about 80% of the India's population. However, another anomaly is the provision of 100% of preventive care only through the public care system. Friends, the government has recently released operational guidelines for the NHM Free Drug Service Initiative and NHM Free Diagnostic Service Initiative that expected to substantially reduce high OP. The government is also working towards strengthening the comprehensive primary care with the continuous of care approach to effective system of referrals. Comprehensive primary care would be incomplete if it is not seamlessly connected to the secondary and tertiary care. This calls for developing a mechanism for continuity of the care so that primary care is backed up by the referral support, specialist consultants and basic hospitalization needs. All states are actively being encouraged to strengthen the district hospital by adding specialties based on IPHS, This would be also require augmentation of the health HR and will throw up a lot of challenges of getting requisite health human resources, specialists, doctors, allied health human resources beside the challenges of re-skilling existing human resources. NHM has also rolled out the National Quality Assurance Program and has also launched Kayakalp as a national initiative to award the public health facilities on set criteria, and this year district hospitals are being taken up for the awards. The government-sponsored Rashtriya Swasthya Bima Yojana, which is a health insurance scheme providing the coverage to BPL population, and 11 categories of unorganized workers is also proposed to reconstruct by the converging the various centrally sponsored health insurance scheme run by the various central government ministries department into a comprehensive health insurance scheme with enhanced coverage and increased benefit and incentivized payment structure to hospital to improve the quality of care being delivered. Friends, we all know the doctors are considered other gods on the earth, and you people have provided that your great effort and contribution. Your service to healthcare are incredible. I wish you people will continue your service to mankind and public welfare. Our government has also taken the step ahead to make healthcare system better. We are looking forward to make India as a healthy India with the help of you. We approved and provided better services in need, as well as we are determined and committed towards the healthcare system. We have already underlined the need for the innovation of new drugs at low cost, which are affordable to the poorest in this country. Even as we sought to strike a balance and commercial medical spendings, we need to innovation not only in technology but also in medical appliances and in methodology. In pharmaceutical, we are good in generic, but we have to consider innovative new drugs at low cost. There should be a balance between the commercial and medical spendings, and innovation of drugs should be available in terms of affordability. My best wishes to the healthcare alliances for its mission of providing the equitable healthcare to the people. Let us all strive collectively for a better and healthier tomorrow. Thank you very much. Jai Hind.
Thank you, sir, for your very motivating and encouraging message, and at the same time you shared the various initiatives which the Government of India has. The Government of India's development plan is in line with the Sustainable Development Goals towards extending healthcare to all and towards also making it more affordable, and that is where he shared with us that the Government of India is wanting and encouraging a culture of innovation and innovation across all disciplines, so that we are able to make healthcare affordable, we are able to extend medicines at a low cost to our people. And where we have India, the world looks at India for medical tourism. At the same time, we have not been able to do much for the rural population. That is where it has to be the people like you, the industry has to come forward in joining hands with the Government of India in realizing this vision, making it a reality for the 1.2 billion population of this country. So thank you so very much, sir. And now I would like to invite Dr. J.K. Singh for his views and his insights.
वर्ल्ड वाइड अचीवर अवार्ड के द्वारा आयोजित इस हेल्थ केयर एक्सेलेंस अवार्ड में हमारे मुख्य अतिथि श्री श्रीपद नायक, जो भी इंडियन सिस्टम ऑफ मेडिसिन आयुष के स्वतंत्र प्रभार के मंत्री, राकेश ऋषि सिन्हा साहब और इस हेल्थ केयर एक्सेलेंस अवार्ड से जुड़े हुए तमाम जितने भी लोग हैं और यहाँ आए हुए तमाम अवार्डी मीडिया के लोग, आज हमें खुशी है कि इस हेल्थ केयर अवार्ड में हमें भी शरीक किया गया। इसके लिए हम बहुत ही आभार प्रकट करते हैं यहाँ के आयोजकों का। ये एक बहुत ही इम्पोर्टेंट एक अवार्ड सेरेमनी एक साल में होता है, जिसमें कि सारे देश के लोगों को बुलाया जाता है। सारे देश के लोगों को चुन करके जो अपने अपने फील्ड में अच्छा काम कर रहे हैं उनको बुलाया जाता है और उनको अवार्ड दिया जाता है। तो इसमें मुझे शरीक किया गया, इसके लिए हम बहुत बहुत आभारी हैं। अवार्ड देना और रिकॉग्नाइज करना किसी के सर्विसेज को, जो समाज के लिए है, जो कम्युनिटी के लिए है, जो हेल्थ पर्सनल्स के लिए है, जो नीडी पर्सन्स हैं उसके लिए, जो अच्छे काम करते हैं उनको रिकॉग्नाइज करना एक बहुत बड़ी बात है। बड़ी बात इसलिए कि इंसेंटिव देना चाहिए, उनको सम्मानित करना चाहिए ताकि वे और अच्छा कर सकें और बढ़िया काम कर सकें। यदि कोई बहुत अच्छा काम करता है और कोई इसे रिकॉग्नाइज नहीं करता है तो उनकी इंसेंटिवनेस खत्म हो जाती है। तो ये जो वर्ल्ड वाइड अचीवर्स हैं, उन्होंने एक बहुत अच्छा काम किया है कि देश के डिफरेंट फील्ड्स के लोगों को हेल्थ सेक्टर में चुन करके अवार्ड देने का काम जो किया है, जितनी भी तारीफ की जाए वो कम होगी। दोस्तों, मेडिकल साइंस एक ऐसा साइंस है जो बहुत ही तेजी से आगे बढ़ रहा है, लेकिन उतनी तेजी से चेंज भी कर रहा है। जितना इसमें चेंजेस हो रहा है शायद किसी और फील्ड में कम हो रहे हैं। एडवांसमेंट भी बहुत है, लेकिन जो चीज़ें आज हैं कल वो पुरानी हो रही हैं। इतने सारे टेक्नोलॉजिकल एडवांसमेंट हो रहे हैं, एक्सप्लोजन हो रहे हैं टेक्नोलॉजिकल, ये सारे के सारे आज जो है इससे बेटर हो रहा है, लेकिन चीज़ें पुरानी भी होती जा रही हैं और नई नई चीज़ें सामने आ रही हैं। इसलिए ज़रूरी है लोगों को अपडेट करना, लोगों को नई तकनीकी क्षेत्रों में आगे बढ़ के जो विश्व में अच्छे काम कर रहे हैं उनके साथ मिलकर काम करना। और हमें खुशी होती है देख करके कि इंडिया काफ़ी आगे बहुत सारे सेक्टर्स में, खास करके हेल्थ में, वर्ल्ड के किसी भी कोने में कोई भी अच्छी इलाज हो रही है, इंडिया उसको टेकअप कर रहे हैं, यहाँ के लोग उसको टेकअप कर रहे हैं और कम पैसे में, किफ़ायती दर पे, बहुत ही कम पैसे में लोगों तक प्रोवाइड कर रहे हैं। हमारे जो डॉक्टर्स हैं कहीं भी वर्ल्ड में किसी भी डॉक्टर से कम नहीं है, और ये जो वो प्रोवाइड कर रहे हैं जो हेल्थ सेक्टर में, हम समझते हैं कि इंडिया डेवलपिंग कंट्री है और यहाँ के लोगों को इसकी ज़रूरत है कि इतने कम पैसे में, इतने कम खर्चे में जो इलाज यहाँ मिल रही है शायद वर्ल्ड में कहीं नहीं हो पाता है डेवलप कंट्रीज में। तो एक बहुत बड़ा काम यहाँ के डॉक्टर कर रहे हैं। हमें लगता है कि कुछ चीज़ों में बदलाव की ज़रूरत है। बदलाव इसलिए, मैं तो ऑन्कोलॉजिस्ट हूँ, मैं कैंसर स्पेशलिस्ट हूँ, हम लोग बहुत ही एडवांसमेंट कैंसर के फील्ड में भी कर रहे हैं। ये एक ऐसा विभाग है जो आने वाले समय में जितने इंसिडेंट्स हाई हो रहे हैं, कैंसर के 12 लाख नए मरीज हर साल जुटते चले जा रहे हैं, आने वाले समय में शायद कार्डियोलॉजी और कैंसर ऑन्कोलॉजी दोनों सबसे बड़ा चैलेंज पूरे हेल्थ सेक्टर के लिए होगा। बाकी बीमारियां पीछे चली जाएंगी, ये नंबर 1 होगा। चूँकि धीरे धीरे कम्युनिकेबल डिजीज़ कम होते जा रहे हैं और नॉन कम्युनिकेबल डिजीज़ बढ़ते जा रहे हैं, और नॉन कम्युनिकेबल डिजीज़ में ये दोनों बीमारियां काफ़ी तेज़ी से बढ़ रही हैं। तो है, हम लोग को है कि समय रहते इसको हम लोग को रोका जाए, नहीं तो फिर बहुत ही संभालना मुश्किल होगा। कैंसर की एक बात है कि हम लोग को लगता है कि हम लोग ट्रीटमेंट कर रहे हैं और पिछले मैं करीब 40 ईयर से कैंसर फील्ड में हूँ और मैं देख रहा हूँ कि ट्रीटमेंट करके हम बहुत एडवांसमेंट नहीं कर सकते, बहुत ज़्यादा चेंज नहीं ला सकते हैं इस देश के सिनेरियो में। यदि हमें चेंज लाना है सिनेरियो में तो हमको थोड़ा अपना टारगेट को फिर से रीडिफाइन करना होगा और हमें अवेयरनेस बढ़ाना होगा, अर्ली डिटेक्शन करना होगा, एडुकेशन करना होगा और इन चीज़ों को प्रिवेंशन करना होगा। और ये सिर्फ कैंसर में नहीं, बाकी सारी बीमारियों में ये चीज़ें करनी पड़ेगी। हम लोग बेसिकली जब डिजीज़ बढ़ जाती है, डिजीज़ जब काफ़ी आगे बढ़ जाती है तब हम लोग शुरू होते हैं। कहीं ना कहीं हर फील्ड में लगता है कि वी हैव टू रीडिफाइन द टारगेट्स इन ऑलमोस्ट ऑल द फील्ड्स ऑफ हेल्थ केयर। और आज इस बात की ज़रूरत भी है। हमारी एक हमेशा कोशिश रहती है, हम लोग IMA से भी जुड़े हुए हैं और एक हमेशा कोशिश रहती है कि हम लोग इन चीज़ों को आगे लाएं। हाउ टू डिटेक्ट द केसेस इन द अर्लीस्ट पॉसिबल स्टेज। इस पर बहुत सारी चर्चाएं परिचर्चाएं हो रही हैं देश में। कैसे इकोनोमाइज किया जाए कैंसर केयर को, कार्डियक केयर को, हेल्थ केयर में और सभी चीज़ों को, इस पर भी चर्चाएं चली हैं। और हमें लगता है कि आने वाले समय में इसकी बहुत ही ज़रूरत पड़ेगी, इसलिए कि आम आदमी हमारी इलाज के पहुंच से दूर होता जा रहा है। इसमें गवर्नमेंट को आगे आना चाहिए, प्राइवेट सेक्टर को भी आगे आना चाहिए और ख़ास करके हम जो हेल्थ सेक्टर से जुड़े हुए लोग हैं उन्हें तो आगे बढ़ के काम करना ही चाहिए। ये तभी हो सकता है जब सब लोग आगे इसको बढ़ावें, एक मुहिम का रूप दें, तभी हम आम आदमी तक, गांव के लोगों तक पहुंच सकते हैं। नहीं तो आज जो हमें लगता है कि हमारी जो मॉडर्न मेडिसिन है वो उनकी पहुंच से दूर होता जा रहा है। तो हमारे IMA का भी प्रयास है कि नहीं, ऐसा यदि करते हैं हम लोग छोटी छोटी चीज़ों को, पानी को, वाटर को, सैनिटेशन को, इन चीज़ों को आगे बढ़ावें, न्यूट्रिशन को आगे बढ़ावें। गवर्नमेंट बहुत ज़्यादा काम कर रही है। आज के नायक साहब हैं, बहुत ही काम आयुष में कर रहे हैं। और एक चीज़ बता दें कि हम लोग का एक प्रयास ये भी है कि हम लोग आयुष को और हेल्थ सेक्टर को, मॉडर्न हेल्थ केयर को, दोनों को मिला के चलें। और मैंने कई सेमिनार कराए कि क्या पॉसिबल है कि आयुर्वेद का भी कुछ हम लोग ले सकें, पैलिएटिव में, किसी भी स्टेज में कोई और पैथी को ला सकें। चूँकि जो पैथी इनकी है वो सस्ती है, हमारी पैथी थोड़ी महंगी है, लेकिन साइंटिफिक बेसिस पर हम लोग काम करें तो शायद दोनों का मिश्रण करके हम लोग कुछ अच्छा काम कर सकते हैं। और एक कोशिश हम लोग की हो रही है। मैंने पिछली बार एक सेमिनार किया, उसमें सारे देश के बहुत सारे लोग आए, दोनों पैथी के, और एक मिला करके काम किया। हमें लगता है कि इन चीज़ों को आगे बढ़ना चाहिए, आयुष और मॉडर्न मेडिसिन को एक साथ मिल के काम करना चाहिए। इसका बहुत बड़ा फ़ायदा होगा। हमने अभी माननीय मंत्री जी से भी ये बातें कही कि ये चीज़ें थोड़ा सा जो भी इसके टॉप रैंक के लीडर्स हैं उनको मिल के आगे आना चाहिए और सिस्टम को मिलाने की कोशिश करनी चाहिए। आज हमें खुशी है कि आज देश के सारे तमाम जिन्होंने कम्युनिटी के लिए, समाज के लिए, लोगों के लिए अच्छे काम किए हैं अपने अपने फील्ड में। हेल्थ तो टीम वर्क है ना, इस टीम वर्क में डॉक्टर की भी अहम भूमिका होती है, लेकिन डॉक्टर के साथ साथ बाकी लोग भी जो हैं उनकी भूमिकाएं कम नहीं होती हैं। तो आज सारे लोगों को जो यहाँ अवॉर्डीज आए हैं उन्हें मेरी बहुत बहुत शुभकामनाएं, और इसी तरह से वो आगे बढ़ के काम करें। और हमें बहुत ही खुशी होगी उन्हें अवार्ड दे के जो इतना अच्छा काम सोसाइटी के लिए कर रहे हैं। थैंक यू सो मच।
सर, आपका बहुत बहुत धन्यवाद अपने विचार हमारे समक्ष रखने का और साथ साथ आपके मार्गदर्शन का, आपकी शुभकामनाओं का। और जैसे कि आपने कहा कि समय रहते हुए बहुत सारी ऐसी बीमारियां हैं, यदि हम अभी से उन पर काम करना शुरू करें, वी कैन अरेस्ट दीज diseases, and towards that all of you again, the industry has a very important role to play. Government जितने अपनी तरफ से कर सकती है, गवर्नमेंट के न्यू इनिशिएटिव्स, प्रोग्राम्स लॉन्च किए जा रहे हैं, पर वहाँ पर जहाँ पर आप लोगों के साथ जुड़े हुए हैं, अपनी सर्विसेज एक्सटेंड कर रहे हैं, आपका बहुत महत्वपूर्ण रोल है। तो आपका सब बहुत बहुत धन्यवाद आपके मार्गदर्शन का।